welcome to FCTV's Discussions on Government. Today, we're talking about 'Tis the season for open enrollment, which starts on October 15th and ends on December 7th for Medicare enrollment. And walking us through this pretty tricky process, but doable process, is Kristina Whiton-O'Brian, and she is the program manager for Barnstable County Government. How are you?
Yes, good, thank you.
Great. So, how are you liking Shine so far? Because I know you're new to the program. Are you right?
Yes. I joined Shine in April, so I'm coming up on my 6-month anniversary and still going to work every day, which is good. And I really enjoy the work that I do. I'm a licensed independent clinical social worker. And being a social worker, I got into the field because I want to help people, individuals, as well as communities. And this position allows me to work with individuals one-on-one, talking about health insurance and what people's needs are medically as well as financially, and the insurance they need to cover those needs, as well as work within the community. Our program covers Cape Cod and the islands, so we are from the tip of Provincetown all the way up to the bridges, as well as Nantucket and Martha's Vineyard. So we are really on the ground in local areas and able to travel. I'm going to Nantucket soon, and it's nice to have that ability to work with the community-based organizations as well as individuals.
So is Shine specifically for Medicare? I'm interested in if you can tell us about what Shine is, and overall, whether it's a federal, a county, a state, is it a mixture? Where do you get your funds?
Sure. So SHINE stands for Serving the Health Insurance Needs of Everyone, which is a long title. And actually, that is a unique name to Massachusetts. This is a federally run program, federally funded program. There are state funds, so the Massachusetts Massachusetts Executive Office of Elder Affairs also administers the program from the federal funds. And Barnstable County also provides some funding as well as local grants. We receive a grant from Cape Cod Health Foundation as well. So it's really this kind of multi-layered federal, state, county, and local community that is joined together to provide this service. So this is run and administered through Barnstable County government, through the Department of Human Services. And there are 2 of us who are employed at the county. And the rest of the program is run with 70 volunteers across the Cape and the islands. So the folks who are mostly meeting with individuals are volunteers. These are your neighbors, local people who live in your community, who are retired mostly and who want to give back. We do have a group of our folks, probably about 20-30% are what we call in-kind. So we've partnered with community organizations to have staff trained to do this counseling as well. But we provide free, unbiased counseling related to Medicare and health insurance options for folks who are 65 and older, as well as some folks under 65 who have disabilities. And it's strictly for Medicare.
Strictly for Medicare.
Yeah.
Okay, so not Medicaid, you would go somewhere else for that.
Yes, however, we do screen folks for eligibility for some programs. So both Medicare and Medicaid are federal government programs. Mm-hmm. Medicare is 65 and over. Medicaid is money that the federal government sends to the states, and that is for everybody from kids, families, as well as folks who are over 65. And we screen for Mass Health Medicaid eligibility for programs that can help pick up some costs. So these are mostly savings programs that can supplement and help folks pay for premiums or co-pays or co-insurance. So it's a little confusing.
Medicaid is income dependent?
It is. It's dependent on income and assets if you're over 65.
Medicare, no.
Correct.
Everyone who's over 65 should apply for Medicare.
Yes, because most of us have paid into Social Security for our Medicare. So as long as you've paid in 40 work quarters, which comes out to about 10 years through taxes, that allows you to get Medicare Part A premium free.
Okay. So there's a lot here.
There is.
What happens if you don't apply at 65 years old?
So
Is there a penalty?
there can be, however, many folks these days who are 65 are still working. So if you're still working at 65 and want to push off Social Security until you're 70, and if you are working for an employer that has 20 or more employees, that is creditable coverage. So you don't necessarily have to sign up for Medicare. However, because Part A is premium free, it might be a good idea for you to sign up for Part A. But these are questions that people have.
Absolutely.
And so they have to call us at the Shine program, and we're able to meet with you to talk about, okay, you're 65 now, because there is a window. And if you don't sign up for Medicare, as you alluded to, there is a penalty. For Part B, which is outpatient doctor insurance, and Part D, which is drug insurance. So there are many parts of Medicare, which we can kind of go through, but it's really important that as you approach 65 and that birthday, that you're either looking at Medicare.gov or you're looking for a local Shine counselor that you can meet with to talk about your options so that you don't get caught unaware and have a penalty to pay later on, because that can be substantial and the penalties follow you for life.
Okay, so you're going to want to listen to this whole show.
Yes.
So you said there's a window to sign up.
Correct.
The window is the open enrollment time, and then there's a 7-month window. So can you talk about the different windows there?
Yeah. So there's the there's the initial enrollment period, which is your birthday. So if you're turning 65, you have 7 months to sign up for Medicare. 3 months before your birthday, the month of your birthday, and 3 months after your birthday. And Medicare, if you sign up before your birthday, will start the first day of your birthday month. If you sign up your birthday month, it will start the next month. And then after that, the 3 months after that will start the month after that. So that's the initial period. So again, you've got that window when you need to sign up for Medicare as you're approaching 65. So that's why it's really important when that birthday is coming up, when you're 64, to be thinking about, am I still working? Am I covered by an employer plan? Am I covered by a spouse? Or am I going to retire and need to collect Social Security and then apply for Medicare?
Okay. So you said you have 2 in the office, but you have these 70 volunteers.
Yes.
And I'm told that Falmouth has about 5 or 7 Shine counselors. Mm-hmm. They used to have more, but COVID took it down a little bit, the numbers. Mm-hmm. They're hoping to pop those back up again. Mm-hmm. Let's talk about the appointments and how people get them, how long they take, what they should bring. What's an appointment like?
Yeah, so for an appointment, the most important thing to do, I think, for open enrollment or a regular appointment when you're signing up for Medicare is to bring your medication list. Now, some folks are very lucky and they're not on any medication. Some folks we've seen might have a list of 2, 3, 10 medications. Right. But that's very important because when you sign up for Medicare or now this open enrollment period, we will do a drug search for you. So an appointment would take about an hour, so you want to kind of carve out that amount of time. You go down to your local senior center or to the Council on Aging, whichever they call it in your town, and you'd meet with a Shine counselor, again, for about an hour. You'd talk about what your questions are, what your needs are. You'd learn a little bit about the different parts of Medicare. And then we have some handouts, because when you're on the Cape and on the islands, only certain plans kind of cross the bridge to come over here to provide plans and services for folks.
Which is interesting because there are less plans available here on the Cape, right?
Correct.
And yet, I did a little research for the state. 14% of people are over 65 on average. On Cape Cod, 26%. And in our town, Falmouth, it's 32%. So 1/3 of the town is over 65, and there's less plans. So you're really going to want to talk to Shine people to get yourself into a plan that's going to work and save you money. It's a little harder to get on a good plan on the Cape, right?
Yeah, and I'm glad that you mentioned the save you money piece, because that's also one of the goals of our counselors and of our program. Because once you retire, you have a fixed amount of money that you've allotted for yourself to live off of every month. And so if there's a new diagnosis or a new medication, that can be a substantial cost that you didn't plan for. I mean, we get calls and meet with folks all the time who have been put on a new drug, and we all see the different drugs that are advertised, and those can be very expensive. And it could be, I had someone call whose mother was put on a drug that's $3,800 a month, and that's not something she has income for. And so the other thing we do in a Shine program is take a look at your income as well as your assets and screen you for any of those mass health programs, which are mass savings programs that could pick up any co-pays or premium costs. Because as I said earlier, Part A is generally premium free, but Part B, so Part A is your hospital insurance.
Yeah, let's talk through the parts.
Yeah, so Part A is your hospital insurance. So, if you need surgery or if you're admitted through the emergency room and you're in the hospital, Medicare pays for a certain number of days. And there's actually also, I think, a 20% co-insurance that you're responsible for through that Part A, but pretty much will pick up whatever that hospital cost is. Part B is for your doctor's fees and your outpatient visits. So in Massachusetts, our Division of Insurance regulates the insurance and what is paid for, what a well visit is, what doctors cover. They also regulate the different Medicare Advantage programs as well and the laws around that. And we're actually pretty lucky here in Massachusetts in terms of what we're allowed. So for example, you cannot be discriminated against if you have a pre-existing condition, which is something really important for a lot of folks. So Part B is that doctor insurance. Part C is kind of separate. That's a Medicare Advantage program, and it combines hospital, doctor, drug, and sometimes dental and eye and vision plans. So Medicare Advantage is something that's really growing in popularity and is very appealing to folks. But again, once you cross the bridge and come to Cape Cod, those plans are administered by insurance companies, not the federal government.
Oh, okay. Interesting.
So what happens is that the federal government, I think, gives amount of money to those insurance companies to manage the plan. So it's an HMO, it's a PPO, it's a managed care plan.
More like we're used to as we work.
Right.
Yeah,
so you've got to go through a referral, et cetera. So those networks are much smaller. But if you stay with what we call original Medicare, which is Part A and Part B, and then opt for Part D drug plan, that is considered original Medicare. And any doctor across the country that takes Medicare will pay for original Medicare will pay for that. So there's more flexibility, basically, with original Medicare. But as I mentioned, there can be that 20% that you're left paying. So that's where supplements come in, or Medigap insurance comes in, for the original Medicare side. Okay. So again, this is why people get confused.
But you did such a good job. I actually think I understand.
Oh, did you? Good. That's great. great,
so
great.
A and B are the original Medicare.
Yes.
Okay.
Yes.
All right.
Yes.
Okay. And now prescriptions. Okay. A and B do not cover that.
Correct.
And I believe that the Biden administration did some infrastructure, they called it the Inflation Reduction Act.
Correct.
And before they hit a few diabetes medications, but recently we were talking before and you said that they hit 10 other medications. So people might be able to save a lot of money on some pretty common drugs, things for diabetes, but also heart medication. I think there's blood clotting medication that a lot of people actually take, maybe ulcerative colitis. I was looking at the list.
Yes.
So there is opportunities for people to get their drugs maybe cheaper next year than this. Is that correct?
Yeah, so the Inflation Reduction Act was passed, I believe, last year. I need my cheat sheets sometimes when I talk about these things, but that and whenever they pass legislation like that, it's kind of staggered out, so things happen in stages. Right. So last year when it was passed, that's when the diabetes medication, so all of that has come into play in 2023. So if you're on a medication for diabetes, you'll notice that that's capped at $35. So things like insulin and other types of drugs, that's going to be very cost effective for folks. By 2025, what you talked about, there's a list of 10 drugs for things, like you said, from heart disease, from autoimmune diseases, et cetera, that will be covered. And you'll see in 2025, those costs reduce as well. So those are things that are going to be very beneficial to folks. And again,
it's good news.
Yes, it is. And Shine counselors are able to have that information. You actually can go on, and I think we'll be showing a video later of going on Medicare.gov. So if you are signing up for a Medicare Advantage program or a Part D plan, you can do that on your own. You can go on Medicare.gov. You can go in and type in your own medications, and you can look at the different pharmacies, the different medications, and what the pricing will be for the entire year. Shine counselors can do that as well. I think sometimes when you're seeing everything come up on the screen, it can be a little overwhelming and a little confusing because there are many, many layers to it. But the system has been designed that either you can go through it or someone through the Shine can go through it as well to help you determine what the best drug plan for you is going to be.
Which I think is excellent cue for us to talk about the video. We're going to show you the video now, which you've brought. And I love me a YouTube tutorial. So I think this is like a YouTube tutorial.
It is.
So people can watch this. It's about 19 minutes long, I think. And slow it down if they want, stop and pause. And I did watch it. And I really felt like it was very, very thorough. It's going to tell people to make a Medicare account, how to sign up for a plan, comparison shop for plans, as well as really go into their drugs specifically. Like I take Lipitor and then pull up the prices for specific pharmacies.
Correct.
Zip code, is that right?
Yes.
Yeah. So let's go to that. Let's roll the tape on that video, shall we?
Sounds good.
Finding a plan has never been easier thanks to Medicare Plan Finder. You can find and compare plans in your area, see your options, and join a plan that best meets your needs. Plan Finder shows estimated costs based on the drugs you take and pharmacies you choose to help you compare plans. And using your online Medicare account makes it faster to add or change your drug list and join a plan. Let's get started. First, visit medicare.gov/plan-compare. Select Login to access your Medicare account for an easier, more personalized experience. If you don't already have an account, select Create one. You can also find and compare plans as a guest by entering your zip code, choosing a plan type, and selecting Start. First, we'll show you how to search for plans while you're logged into your account. Later on, we'll show you how to search for plans as a guest. We'll start by selecting Login. To log into your account, enter your username and password, then select Login. If you have Medicare but don't yet have an account, select Create an account now. After logging into your Medicare account, you'll see a summary page with your name and current plan. This page also includes other information like the plan name and application number if you've applied to join another plan, any extra help you might be getting with your drug costs, your saved pharmacies, your prescription drug list. During open enrollment, October 15th through December 7th, you'll also see the plan you'll have for next year, as long as the plan details are available. If next year's plan details aren't available yet, you'll get a message telling you to contact your plan for more information. A new feature on your summary page lets you compare your current plan to the plan you'll have next year. Select Compare Plan Details to see a side-by-side overview of your current plan and the plan you'll have next year if you don't make a change. You can compare things like deductible amounts, customer ratings, and estimated costs for different items and services. Keep in mind that prescription drug cost estimates are based on your saved drug and pharmacy lists, so it's important to keep those lists up to date. We'll talk a little more about those lists now. Let's go back to the summary page. Let's look at the pharmacy list first. Adding pharmacies helps us give you better estimates of your prescription drug costs. If you haven't logged into your account recently, you'll see a message on your summary page reminding you to review the pharmacies on your list. If you need to make a change, you can select Edit My Pharmacies. To delete a pharmacy, select Remove Pharmacy. To add a pharmacy, select Add Another Pharmacy. You can pick pharmacies you use now or choose other pharmacies in your area to see if one may offer lower costs. You can save up to 5 pharmacies on your list at one time. Drug costs can vary in each plan based on the pharmacy you use. Picking different pharmacies lets you see how plans work with those pharmacies and which would have the lowest costs. To find pharmacies in your area, you can enter your address or a specific pharmacy name or search by zip code. We'll enter the zip code 21224 and then select Find Pharmacy. You can filter your search results by distance from your address or zip code. For example, you can choose to only see pharmacies that are within 1 mile of your zip code. You can also use the map on the right to see each pharmacy's location. Each pharmacy you select will appear in a box within a blue bar at the bottom of the screen. You'll see 5 boxes, but if you've saved fewer than 5 pharmacies, some of the boxes will be empty. To remove one of the pharmacies from your list, select the X to the right of the pharmacy name in the blue box. You can also uncheck the box next to the pharmacy name on the search results list. When you're done adding pharmacies, select Done on the far right side of the blue bar. Then select OK to return to your summary page. Your summary page will display your updated pharmacy list. Generally, preferred in-network pharmacies offer the lowest cost for drugs. In-network pharmacies are usually less expensive than out-of-network pharmacies, but more expensive than preferred in-network pharmacies. Out-of-network pharmacies usually have the highest drug prices. You'll be able to see the costs of your drugs at each pharmacy in Plan Details later in your search. We'll talk more about that later. A little further down on your summary screen, you'll see your drug list. If you have at least one drug on your saved list, but you haven't logged into your account recently, you'll see a message reminding you to update your drug list with any prescription drugs you currently take. In this example, we haven't added any prescription drugs yet. You can select Add a Drug to search for prescription drugs you currently take and add one or more to your saved list. Let's add a drug now. Begin typing to find your drug's name. You can also use the Browse Drugs A to Z feature to find your drug. Let's add Lipitor, a drug that's used to treat high cholesterol. We'll type the first few letters of the drug name and then choose Lipitor when it appears in the drop-down menu. We'll then select Add Drug. If your drug comes in a generic form, you'll see a message asking if you want to add the generic or the brand name to your list. Select either Add Generic or Add Brand instead, depending upon which version you want to add. we'll add the brand version. Next, add more information about the drug, like the dosage, quantity you take, and how often you get the prescription refilled. Select Add to my drug list to return to your list of saved drugs. If your drug list is missing a prescription drug you take regularly, select Add recently filled drugs to see all the prescriptions you filled in the last 12 months. Check the box next to each drug you currently take. Or if you take all the drugs shown, just check the top box to select all the drugs. Then select Back to my saved drugs. If you check a box by accident, it's fine. Just select it again to uncheck it. Remember, don't list drugs you take temporarily, like an antibiotic. This will help you better estimate your regular drug costs and help you find the lowest cost plan. We'll add one of the drugs on the list, Nexium. When you're done adding drugs, select Back to my saved drugs to go back to your drug list. Then select OK to go back to your summary page. Now that we've reviewed the information you'll see on your summary page, we're ready to search for plans. First, select Find Plans Now, which you'll see at the top and bottom of your summary page. Start by choosing the type of plan you're interested in. You can choose a Medicare Advantage plan, a standalone drug plan, a standalone drug plan plus a Medicare supplement insurance policy called Medigap, or a standalone Medigap policy. If you're not sure where to start, you can also choose to learn more about your Medicare options before you see plans. Let's choose Medicare Advantage plan here, then select Apply. Next, check to make sure your zip code is correct. Select your county and select Start to see your search results. For now, we won't select Start. Instead, let's search for plans as a guest. To do that, we'll go back to the main Plan Finder page to start a new search without logging in. First, pick your coverage year. The screen will automatically default to 2023 coverage unless you select 2022 instead. Next, choose a plan type and select Apply. Then, enter your zip code and select your county. We'll search for 2023 Medicare Advantage plans in the 21224 zip code. Next, we'll ask if you get help with your costs from programs like Medicaid or Extra Help. Once you answer the question, select Next. We'll also ask if you want to see drug costs when comparing plans. This can help you get a better idea of what your out-of-pocket drug costs would be in each plan. If you check Yes and then select Next, you can add the prescription drugs you're currently taking. Since you're not logged in, you'll add each of the drugs you take one at a time. You can do this by typing in the name of the drug or by using the Browse Drugs A to Z option. If you decide you'd rather get your search results without drug cost information, you can select See Plans Without Drug Costs. Let's add lisinopril, a drug that's used to treat high blood pressure. Then select Add Drug. Next, add more information about the drug, like the dosage, quantity you take, and how often you get the prescription refilled. Select Add to my drug list to go back to your drug list. You can continue adding drugs or select Done Adding Drugs when you're done. Next, you can choose up to 5 pharmacies where you would fill your prescriptions. You'll search for and select pharmacies the same way we did when we were logged into an account. When you're done choosing pharmacies, select Done on the far right side of the blue bar. Now let's take a look at our search results. If you're logged into your account, the first plan you see will be your plan for next year if you don't make changes. You won't see this information if you searched as a guest. It's a good idea to look at your plan's benefits for next year to see what's changed and if your current plan will still meet your needs. When you're done, you can minimize that window by selecting your next plan. If you want to see it again, just select your next plan again. Here's how your results screen will look if you searched as a guest. To narrow down your list of plans, you can filter your search results by things like plan benefits, drug coverage, star ratings, and more. For example, if you only want to see plans that include both vision and dental, select those choices from the Plan Benefits filter. If you only want to see plans with drug coverage, select that in the Drug Coverage filter. You can also filter by plans for people with certain needs. For example, there are plans that are just for people with both Medicare and Medicaid, people with a chronic or disabling condition like cancer or dementia, and people who need long-term care in a facility or at home. Pick all the features you want your plan to include and select Apply in each filter drop-down box. As you pick more features, your screen will refresh with updated search results. Let's filter our results to only include plans with vision, dental, and drug coverage. Plans are sorted automatically by the lowest drug plus premium cost, but you can sort in other ways too. Let's take a look at the plan information. As you view a plan, you'll see many important things to consider. If available, you'll see its overall star rating between 1 and 5 stars. You'll also see some of the different costs and benefits it offers and whether it includes drug coverage. Looking a little closer at the costs, you'll see the plan's monthly premium. Since we're looking at Medicare health plans, the information reminds you that you need to keep your Part B coverage to join and stay in the plan once your plan coverage starts. Remember, you'll have to pay your Part B monthly premium in addition to the plan's premium. You'll see your estimated yearly drug plus premium cost since this plan includes drug coverage. This amount is an estimate of the costs to fill the drugs you entered at the pharmacies you chose, plus your monthly premiums. But it doesn't include any estimated health costs like copays or deductibles. If you're looking for a plan for next year during Medicare's open enrollment, this cost will provide an estimate of the amount you may pay for your premiums and drugs for the entire year. But if you're looking at plans in the middle of the year, this will include costs for the rest of the months left in the year. For example, if you're looking at plans in May, it will include the costs for June through December. Remember, this estimate doesn't include other costs for health services. You'll also see other costs like deductibles and the maximum amounts and copays you pay for health services. To learn more about what each of these items are, click on the underlined text to open a window with more information. To get more details about a plan, its costs, and what's covered, select Plan Details. You'll see an overview of cost information like what you'll pay for your monthly premium and primary doctor visits. Use the menu across the top of the screen to quickly find the details you want. To see more details about extra benefits the plan covers, like vision, hearing, or dental, you can select Extra Benefits. You can also look in the drug coverage section to see how the plan works with each of the pharmacies you chose. It will tell you if the pharmacy is in-network or out-of-network. Let's look at pharmacies. Generally, drug costs are lowest at a preferred in-network pharmacy. If none of the pharmacies you chose are preferred in-network, you'll see a message telling you to consider adding one. You can select Find Preferred in-network pharmacies to search for and add a pharmacy that's preferred in-network. As you scroll down, you'll also see detailed information about the yearly cost for each drug you take at each pharmacy you chose. If a drug you take isn't covered by the plan, you'll see its full retail cost. If your drug isn't covered, you can look at other plans or consider asking your doctor whether you can take a generic drug instead of the brand name drug to help lower your costs. Generally, you'll want to look at your estimated total monthly drug costs to see your costs broken down for each month of the year. Next, scroll down and select View More Drug Coverage. If a drug on your list has a safe and effective alternative available, you'll see a message under Other Drug Information. To learn more, select Does my plan cover a safe and effective alternative drug? When you're done looking at plan details, scroll to the top of the page and select Back to Search Results. You'll come back to your search results. Now, let's learn how to compare plans in Medicare Plan Finder. You can select up to 3 plans to compare at one time. To select plans to compare, check the Add to Compare box. You'll then see it in the blue bar at the bottom of your screen. If you're logged into your account and currently in a plan, you'll see the plan automatically included in the blue bar. You can keep it for the compare, or you can remove it if you want to compare a different plan. If you're searching for plans as a guest, you can select any 3 plans to compare. Once you've added all the plans you want to compare, click Compare on the right end of the blue bar. We'll pick 3 plans to compare. Now you see all of the plans you chose side by side. First, you'll see basic cost information like premiums and deductibles. Then, scroll down to see more information about each plan, like benefits and costs, whether the plan covers extra benefits, and a quick view of your estimated drug plus premium cost for each pharmacy you chose. When you find a plan you're interested in, scroll to the top of the page and select Plan Details for more information. Or return to your search results by selecting Back to Plan Results at the top left of the compare screen. When you find the plan you want to join, select Enroll. Or, if you would like to stay in your current plan for 2023, you don't have to do anything. A pop-up window will start your application to join the plan. When you're done with your application, you'll get a confirmation number. You can also contact the plan directly to join. To get the plan's contact information, select Plan Details. The plan's contact information is at the top of the Plan Details page. Once you submit your application to join a plan, you'll hear from the plan within 10 days, or log into your account to see the status of your application. Need more help picking a plan? Call 1-800-MEDICARE, 1-800-633-4227. TTY users can call 1-877-486-2048. For more information, visit Medicare.gov. This product was produced at U.S. taxpayer expense.
So we're back, and hopefully that video was important for you and really helped you look at your own particular issues, your own particular plans that you have and your needs. So Kristina, what did you want to say about that?
Yeah, so one of the reasons why we're showing this video is so that you can do this on your own. However, we are, as you mentioned at the beginning, in open enrollment period right now, and this is the time when you really want to take a look at your drug plan and call Shine to make an appointment, or you can, now that you've learned and watched the video, do it on your own. But Shine is also there as a resource for you. So right over the past couple of weeks, you've probably been getting a lot of material in the mail. And what you want to do is look at the letters and the information from the current company that is providing you your drug coverage right now, because they're going to tell you how much it's going to cost you next year. And many of those letters may say the cost is going up, and some may say the cost is going down. But if the cost is going up, that's why you want to either call Shine for an open enrollment appointment, or you want to go on Medicare.gov and watch that tutorial, and as you said, pause it and put in your drugs and decide if this is still the best plan for you, or sign up with a new one. I've heard stories from our Shine counselors that one story stands out to me because our Shine counselor saved someone $23,000 in a year on their medication. And they were so excited. They told everybody in the office, but that's a significant amount of money that someone was able to save by seeing a Shine counselor. So those appointments book up quickly. Some councils on aging are booking appointments now. So if you can't get in, the video is very important for you to learn how to do it on your own. But if you can get in, meeting with a Shine counselor can be very helpful and can really save you some money.
Can it be done remotely? Can you have that appointment?
Yeah, so, the pandemic emergency is over, and we are seeing people in person. However, we are hearing about people it's the time of year, people are getting coughs and flus and colds. So some places are offering phone counseling or video counseling. So it's just a matter of whatever the folks at the Council on Aging where you live are willing to do. But we are doing phone, in person, however it is.
Great. Yeah. All right. So I want to meet with the person who saved someone $23.
Yeah.
How do you become a Shine counselor? What does it entail?
Yeah. So I actually just went through this because I'm new in my position and had to go through the training. So it's actually 40 hours of training, which is quite a long time. We did a hybrid model, so some of it was online and some was in person. But you learn all about Medicare and some of those other mass health savings programs as well. You learn how to share the information with people. And then you have to take a test, and it's an 80-question test, actually, that you have to pass. And then you have to get recertified every year, and you have to test every year. And the recertification test is 40 questions. So it is not for the faint of heart. It's a lot of work, but it's an incredibly crucial service that we're providing to, as I said earlier, our neighbors and our community members, because it can really save people money who, are struggling and, who need that extra help to, help them live a fruitful life in their retirement and not be bogged down by medical debt.
Yeah, huge. It's a huge thing. I'm wondering, are there any phone numbers that you want to just pull out there that you think are important?
Yes. If you're interested in becoming a Shine counselor, you can call us at the county, and that is not in my head. It is on the website.
Okay.
So we can probably put that on the screen or share it
Certainly.
at the end.
Yeah.
So just call.
Sorry
yeah. No, that's okay. So just call the county office. You could also call your local Council on Aging. Many people,
the senior center.
Yes. Yeah. So when I'm traveling across the Cape and going to the senior centers, folks are there for yoga, for book group, to play poker or whatever. And if this is something that you're like, I want to do a little bit more to help others, or, I had a good experience with a Shine counselor, or I worked in health insurance, or I worked in a doctor's office or a dentist's office, or I'm a retired social worker. We're welcoming anybody who's interested in just giving back and has the time and the commitment to do this. So,
really
just reach out.
Can you talk about any scams? Do you see any scams, or maybe there's TV advertising that you think is a little bit misleading? What do you want to tell people about that, or looking, because they're probably getting flooded with information right now in their mailboxes or on TV?
Yeah, so a couple of things. One is that, as you said, people are getting a lot of information in the mail. They're seeing a lot of ads on TV, especially with their local sports heroes or actors that they really like. And those plans may sound great, but again, those are mostly Medicare Advantage plans that are not here on the Cape. Medicare Advantage are managed care plans with doctor networks. So you want to make sure that if something looks really good, you call your doctor's office and you see if they are able to bill that plan. So I think that that's one of the most important things, is that everything you see on TV or get in the mail doesn't translate to Cape Cod and the islands. We're very different down here. Okay. And the Shine counselors can give you the list of plans that are accepted by the providers down here on Cape Cod and the islands. And it's a much smaller list. The other aspects of scams are, people getting phone calls, getting text messages, asking for personal information, asking for money. And what I want to be clear is that Medicare is not going to call you on the phone. They're not going to ask you for your Social Security number. They're not going to ask you for money. So, if you're getting any of these types of phone calls, if you're getting emails or text messages, there's actually something here in Massachusetts, and it's across the country, called the Senior Medicare Patrol, or SMP, and they are there as a resource to call up and share a story with them if you get a phone call that you're a little worried about. Because I think one of the things is that these are professionals who are scamming people. They create a sense of urgency. They create a sense of desperation with people, and it's scary. And so, you don't want to lose something, so you automatically feel like, oh my gosh, I have to do this. But when you're feeling that way, take a pause and talk to a family member, call your local police station, or call the Senior Medicare Patrol, because since the pandemic, I think there was a statistic I saw that scams have gone up over 400%. And people have lost tens and hundreds of thousands of dollars. And we don't want that to happen to folks in our community. So just really, if you're getting those kinds of things, please reach out and ask for some help and to go through it.
Okay. So that's good. You are a Shine counselor.
I am.
Have you had an opportunity to do some counseling yet, or are you busy with your other hat on?
Yeah, that's a big other hat that I wear as the program manager. So I have, I've done a lot of shadowing, and I've shadowed several different types of people to get a sense as to how people approach an appointment and how they share the information and the material. I have met with some individuals. I do a lot of phone work and talk to folks on the phone. One of the biggest challenges are those folks who might be dually eligible for both Medicare and Mass Health and some of those other Mass Health programs. Right now, we're going through something called the Medicaid unwinding, and that is happening across the country as well as here in Massachusetts. It's also known as Mass Health redetermination. So what happened was that during the pandemic, everything kind of froze. So if you were on Mass Health would just continued because there was so much going on. We didn't want people to lose their health insurance.
Right, fall through the cracks in the middle of COVID. Right.
So people were turning 65, they were on Mass Health, maybe they didn't sign up for Medicare because everything was kind of stopped. So now the federal government and the state of Massachusetts are sending out blue envelopes and notices to folks who are on Mass Health saying, you haven't heard from us in a while. We want to take a look at your income and your assets and see if you still qualify. So that has become very problematic because a lot of folks are missing stuff in the mail. They may have filled out information and getting denied and then not knowing where to turn. So it's taking, so there are a lot of different layers to go through and a lot of different ways to try to find support for those folks. So we're actually seeing a lot of that now with people, needing to share more information with the state that they didn't have to share before and hearing that they don't qualify for Mass Health. And then, how do I get on Medicare sooner rather than later? So we're really trying to help those people, but those are some real difficult situations, and we're trying to do our best to get through those. And right now, we have open enrollment coming up. So the good news is that Shine, especially for Mass Health, is not the only organization to help people with that. The Community Action Center for Cape Cod and the Islands also helps with that. Elder Services is training their folks to also help with folks over 65 with that Mass Health redetermination and should be getting information out to the public soon. Local community health centers have navigators and other individuals who can help with Mass Health. And then you can go on Mass Health or mass.gov and find where to go for some help with Mass Health as well. So that's something else that's kind of happening right now. And those are some of the those are very challenging situations.
Yeah, for sure. What has Shine got coming up next after you finish with open enrollment? What have you got going on the rest of the year?
Yeah, so we're going to take a little bit of a winter's nap, I think.
I bet you are.
Yeah. And then we're going to get into, I think, recruitment of Shine counselors, because our kind of cycle throughout the year is after the holidays and the new year, kind of catching up with some stuff that maybe we weren't able to get to during open enrollment, and then getting out again to the communities and finding people who want to come forward as volunteers. We'll then look at applications in the month of March and April, interview folks, and then in May and June is when the training will take place. And then over the summer, June, July, and August is when folks mentor so that they're ready in September and October to get out there and work with folks during open enrollment. But, you know, as you talked about earlier, Eileen, so many people down here on Cape Cod are older, and people are turning 65 every day. So, you know, not only do we have these special time periods when we need to take a look at drug plans and Medicare Advantage plans, we also have folks, as I was talking about earlier, turning 65 every day. So we're trying to do birthday parties, or, you know, I think we might do something in the spring with Medicare and mocktails, and go to Councils on Aging, where we have these group presentations and talk about this information with groups of folks. So that will be coming up in addition to that recruitment, and then we'll just kind of get back in the cycle again.
Wonderful. All right. So is there anything else you want to cover before I think our time is almost done, but is there anything you want to add or make sure people know about?
Yeah, I think the only thing I really want to add is how grateful I am for our counselors. You know, we have, as I said, over 70 folks across the Cape and the Islands who are volunteering their time, and we could not do it without them. I get to meet with them every month. I get to talk to them on the phone. I get to email, and it's been wonderful to develop this new network of colleagues and friends, and learn from them, because many of them have been doing this. We have one Shine counselor who's been doing it for over 20 years. So it's been unbelievable. And the fact that these folks are volunteering their time and going the extra mile to really help folks and to make phone call after phone call, to advocate, it's really wonderful. So I'm incredibly grateful for all of our Shine counselors, and really just am grateful to have this opportunity to work on behalf of Barnstable County and the people of Cape Cod and the islands.
They must be great people, to do all that work, volunteer. Last question, if I could.
Sure.
How will you know you're successful? Do you have numbers that you want to hit?
Yeah, so I think last year we served during open enrollment or within the year between 5,000 and 6,000 people, and we're looking to increase that every year. And, you know, I gave that one example of $23,000, but, you know, there are thousands of dollars that we save people, and I'll have to do a better job of tracking the numbers. But it is actually important because Congress takes a look every year at how much money we're saving people to decide if they want to continue the program.
ROI, return on investment. So, that is the $23,000 alone.
Yeah,
wow.
yeah. So if I'm invited back, I'll make sure I have numbers of how much money we were able to save people and how many people we service, because that's going to be exciting. Yeah, it'll be exciting to see.
And you are, of course, invited back. I hope you come back when you're recruiting or when you're doing some educational seminars. We really appreciate what you do.
Thank you.
Thank you so much for coming in. And thank you all for watching, and we'll see you next time.